Contact lenses are still actually a very popular option for people, although interestingly enough, glasses have become so fashionable that a lot of people have actually switched from their contact lenses to their glasses. But a lot of folks find out that wearing contact lenses, very nice freedom, I guess it would give them, allows them to be able to go ahead and do sports or be outside without a pair of glasses so they can wear sunglasses over top. So we do still fit quite a number of contact lenses on people. So contact lenses, of course, are something that go over the eye itself, and we do like you to have a break from that. So we don't necessarily want you wearing contact lenses 24 days or 24 hours a day, 7 days a week, of course. And so we do want people to take a break from their contact lenses, although there are some contact lenses available now that do allow folks to sleep in them overnight, and they're much better than what they used to be. So in certain circumstances, we will allow folks to sleep in their contact lenses overnight. But contact lenses are certainly something that you can wear on a daily basis. There's newer lenses that you can actually throw away every day. So every day you're putting on a brand new pair of contacts, which of course cuts way back on infections and things like that. So the cleaning of contact lenses has actually become quite a bit simpler than what it used to be. Nowadays, most of the contact lenses are simply a multi-purpose solution that folks can just rinse off their contact lenses with and store them in a case at night. But again, because you're replacing the contact lenses a lot more often, usually every 2 weeks to a month, you're not having to go through some of those really long, tedious cleaning regimens that we used to have to do with lenses. So there's always a concern about getting water in your eyes with contact lenses, especially if you're swimming in a lake or a river or something along those lines. There's things in the lakes and rivers that certainly could get under your contact lenses and cause some pretty serious infections. And so we ask people not to wear them in those situations. In pools, in swimming pools, in treated water, again, just being cautious with it. If you can wear goggles over top, that would be fantastic. If you can get away with not wearing your contact lenses, that's even better. But mostly in the swimming situations that we're more concerned about wearing contacts. Sometimes we see infections in contact lens wearers, and especially infections that can cause what's called a corneal ulcer, which is essentially a divot in the surface of the eye. And these can be very devastating to the vision if they're allowed to go and if we can't get them under control. And oftentimes the reason that people are getting infections or are getting corneal ulcers is because they've been overwearing their contact lenses, keeping them longer than we say that they're supposed to have them for disposing. So for instance, if they're in a 2-week contact lens, they're keeping it for 6-8 weeks before they're throwing it out. The longer you keep that lens, the more likely it is that you can get bacteria, dirt, things on that lens that can cause you to get long-term infections. So at the first sign of any real redness or pain, you should remove those contact lenses right away. And if the problem persists, or you notice that your vision has gone down, or you're getting a lot of discharge from the eye, a red eye, a painful eye, we want to see you right away for that. The sooner we see somebody with a contact lens related complication, the faster we could get it treated, and the more likely it is that they won't have long-term problems.